Alhamdulillah, we will now progress with the content of this Blessed Summit, the main topic, and we have a series of speeches throughout this whole weekend. Tonight we have several, and we have throughout the whole day of Saturday and Sunday, in which we will address the various facets that affect us in relation to mental health. We're all aware that mental health is a growing crisis. We can all probably know somebody that's related to us in our circle, our social circle, or in our family that is suffering from a form of mental health issue. And we can see that in the form of depression, anxiety, and all sorts of other symptoms that arise from that. And throughout the weekend, our experts and our panel speakers will talk about this topic in detail. It's quite staggering how much the mental health crisis has amplified, especially over this period of the pandemic of COVID-19. When we all talk to people at work and people in our circle, the stress and anxiety of being at home, locked at home in lockdown, has actually amplified a lot of issues. 1 in 4 people suffer from mental health problems. Approximately 450 million people in the world suffer from this disorder. And suicide is on the rise. One person dies every 40 seconds from suicide. And depression, anxiety has hit not just men, but a ceiling of, well, not a ceiling, but has increased significantly within the female population as well. So this whole crisis of mental health does need to be addressed, and we have to really think about what we're going to do to tackle this as a community and what Islamic solutions we can provide. We will now move on to our next speaker, Dr. Abid Iqbal Sahib, and just to sort of explain a bit more about Dr. Abid's background, he is a GP in Bradford, and which is in West Yorkshire for those people who aren't aware, and he completed his undergraduate training in Manchester and postgraduate training in Bradford, where he currently resides. He is a portfolio GP and is a training program director for the Bradford GP training scheme. And he's got a whole wealth of medical experience. But not only that, he has a wealth of community experience of providing assistance to people in the community and mentoring people. So he's in a very good position to be able to talk about the topic entitled Causes of Mental Health Issues Globally. With his oversight on this, I think it'll be very interesting to hear what he has to say. So without further ado, let's move on to Dr. Abid Iqbal Sahib. Shukriya.
أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم الحمد لله رب العالمين والعاقبة للمتقين والصلاة والسلام على أشرف الأنبياء والمرسلين أما بعد قال الله تعالى عز وجل في القرآن المجيد والفرقان الحميد في شان حبيبه مخبرا وآمرا إن الله وملائكته يصلون على النبي يا أيها الذين آمنوا صلوا عليه وسلموا تسليما اللهم صل على سيدنا ومولانا محمد وعلى آل سيدنا ومولانا محمد وبارك وسلم عليه. Respected brothers and sisters, Assalamu alaikum wa rahmatullahi wa barakatuhu. Welcome to this year's Blessed Summit on Mental Health, and in this short talk we will be talking about the causes of mental health problems in keeping with the theme for this year's Blessed Summit, the 2020 Blessed Summit on mental health and Islam. As you can imagine, this is a very broad and complex topic to do justice to in a few minutes, but I'm going to try and touch upon a number of factors that affect good mental health. So first, before we can really begin this topic, it's really important to really define what we mean when we say mental health. And if we look at the dictionary definition, which states mental health to mean a person's condition with regard to their psychological, emotional, and spiritual well-being. And when we say a mental illness or mental health problem, we refer to a shift in the normal psychological, emotional, or spiritual condition of a person. And this can be in a whole over a whole wide spectrum of types of mental illnesses and with varying degrees of severity within the presentation of each of these. So the first thing to really discuss when we're looking at a topic like mental health or mental illness, if you like, is to really define the benchmark of normal. Um, and normal in terms of mental health is quite difficult to define because there's normal represents a very broad spectrum of states and conditions, and depending on the background and environment of an individual, normal can vary. This said, some normal emotions, if prolonged or applied outside of their normal context, can actually be signs and symptoms or demonstrate signs and symptoms of mental illness. Let me give you an example in this regard. Let's take, for example, the loss of a loved one. In this situation, it would be normal for us to express or feel grief and at the loss of a loved one. It would be normal to feel upset and tearful and perhaps slightly withdrawn and subdued for a short period whilst we're reflecting on our loss. So this we would if you like categorize as a normal bereavement reaction. However, if you take the same emotional response of feeling low, feeling subdued, feeling tearful, but for a prolonged period of time, and in the absence of any such event that has occurred, so if you hadn't lost someone, if you were just feeling down, feeling low, feeling withdrawn and subdued for a prolonged period, this would be considered pathological, albeit the same emotion that you were experiencing in the context of where you had lost someone. So in this case, we would label the abnormal response as depression or low mood. But we must acknowledge that obviously, as part and parcel of being human, emotions exist, and having good and bad days can be part of the normal day-to-day life of a human being. So it's normal to have happy days and sad days, joy and grief are normal parts of life, really. And it's important that we recognize that these emotions are part and parcel of a normal person's life. It's only when they're exaggerated or prolonged or misplaced out of context that these emotions can suggest signs and symptoms of mental illness or mental health problems. Now, mental illness can range from a shift in our spiritual, our emotional, or our psychological well-being over a whole spectrum from in varying degrees. So you can imagine this can range from mild degrees of anxiety or panic or depression or phobias, where a person is able to function despite having some of these mental health problems, to something more severe like post-traumatic stress disorder, often referred to as PTSD, obsessive compulsive disorder, OCD, and yet more serious mental illnesses like psychosis, bipolar conditions, schizophrenia. In these conditions, sadly, the individual's insight and ability to function is often impaired, which presents a more significant and serious risk to both the individual's well-being as well as the people around them. Now, contrary to superstition and various other cultural stigma attached to these conditions, mental illness is actually very, very common. In fact, 1 in 4 people will experience mental health problems. So if you think of four people that you know, on average, one of them is likely to suffer with a mental health problem every year in England. 1 in 6 people are reported to experience common mental health conditions like anxiety and depression in any given week in the United Kingdom. And as a Muslim, we have a responsibility to look after our own physical as well as our spiritual and mental well-being. So hopefully in this short talk, we'll be looking at the causes of this shift from the normal state of emotional, spiritual, psychological well-being resulting in mental health problems. And this is as I'm sure you can imagine, a very complex phenomenon. So we're not really going to do justice to the depth of this conversation in a period of 10-15 minutes. But hopefully, if we can just touch upon some of the common factors that can cause or contribute to this complex imbalance. And I'd be lying if I said there was one factor on its own that is the complete cause of all such problems, but it's rather more like a combination of different factors that end up contributing towards this imbalance. And hopefully, through this session, I hope that we're able to use this session to recognize some of the root causes and triggers behind mental health problems, so that we're able to understand ourselves better as humans, so we can live hopefully more balanced lives, and we can empathize sincerely and genuinely with people who do suffer with problems such as these, often through no fault of their own, and hopefully try to mitigate against some of these causes and build resilience in ourselves, in our families, in our loved ones, against the problems that can obviously result in mental illness and mental health issues. So I'm going to spend a few minutes to talk through some of the common associations and causes that have been linked to mental health problems. It's certainly not a comprehensive list and certainly not an absolute list, but it's just to give you an idea, a glimpse of some of the conditions or circumstances that can contribute to mental health problems and create an imbalance that we discussed earlier. Now, some things are out of our control. So the first thing to talk about is genetics. There is a strong biological component to some mental illnesses. This means that some of us are more prone to getting some degree of mental illness than others, and this is determined by our genes. Our genes are information codes that are passed down to us from our parents, and we get half of our genetic code from our father and half from our mother, and this usually codes for our biological features like our eye color, our hair color, our height, our complexion, and to some extent our vulnerability to mental illness is also part of this. Now, like our eye color and hair color, we don't have control over these things. This is essentially who we are, and we can't influence our genetic code. And it's important to recognize that these things are essentially from birth. When we're born, we're essentially landed with the genes that we have, and we don't have any control over this. The other aspect of mental illness is our environmental factors, and to some extent we can control these, but to a large extent sometimes we can't control them, especially in our early years when we're in our childhood, and certainly periods in utero when the child is within the mother's womb. The child has very little control over what the child is exposed to. And there's now emerging evidence around something called adverse childhood events, or ACEs. Now, this is a term used to describe traumatic experiences before the age of 18, which can lead to negative, lifelong emotional and physical outcomes. So ACEs include things like childhood abuse, physical, emotional, sexual, physical and emotional neglect, substance misuse, domestic violence, even towards the mother whilst she's pregnant with the child or in the presence of a child, acrimonious parental separation, and divorce, and incarceration of a relative. All of these experiences for a child can be categorized as an adverse childhood event. All of these things, as you'll know as Muslims, are things that are disliked or forbidden, and having increasing number of these adverse childhood events, or ACEs, has been shown and linked to increased incidence of mental health problems such as depression, anxiety, and poor self-esteem. as well as a whole host of other physical conditions. And this is a very interesting and complex area, and it's an emerging area of research now. But to give you an illustration of what I mean, to compare those who have to compare a person who has no adverse childhood events with someone who had, for example, 4 of the adverse childhood events that I've mentioned earlier, the person who has had 4 or more ACEs are twice as likely to binge drink and have a poor diet, are 3 times more likely to be a smoker, are 5 times as likely to have had sex before the age of 16, are 6 times more likely to have caused or have an unplanned teenage pregnancy, are 7 times more likely to have been involved in violence in the previous year, and 11 times more likely to have used heroin or crack or been incarcerated. And if we increase that to 6 ACEs, the statistics are staggering. In fact, by 4 to 6 times the risk of becoming an IV drug user is increased, and by 35 times the risk of suicide. So this is very, very serious. And to think that this is all determined during a period where we have very little understanding or very little appreciation of our environment. In fact, even when there's some research now suggesting that even when the child is in the womb of the mother, the stress hormones of the mother can affect the modeling of the brain to heighten the levels of anxiety in the child. This is obviously an area of expanding research, but a very, very interesting a very, very interesting area because it's exploring some of the earlier years and how it affects the outcomes later in life. I mean, to say genetics and our childhood is to blame for everything would not be true. So we can't absolve ourselves of any responsibility of maintaining good mental health just because our genetics are letting us down or we've had a traumatic childhood, albeit we can't ignore those facts. We must acknowledge the existence of the genetics and the family history, if there is one, and also the experiences that we've all had as children. As Muslims, we must remember that Allah does not burden us or burden a soul beyond that which it can bear, which suggests to us that whilst many people may have had very difficult and complex challenges in their life, we also believe that Allah Almighty provides us with the resilience and strength to pull through these challenges with His support and assistance, and we must never be in despair of His support and help, no matter how difficult things can get. Now, other common causes of mental health issues can be more behavioural, so things like, for example, loneliness and social isolation. Now, these are 2 very different things and are very commonly linked to mental illness, such as depression and anxiety. Loneliness, for example, if we take that first, is about the perception of someone feeling alone. Now, this doesn't necessarily mean that there's no people around them. In fact, some people feel lonely in very big cities or in large families or in large care homes. People can still feel extremely lonely. Loneliness is associated with a lack of intimacy and the absence of a deep and meaningful relationship rather than the absence of people around them. And often loneliness coexists with social isolation, which is the absence of other people. And to a large extent, the 2 often coexist. But we mustn't forget that people can feel lonely even when they're in a relationship, even when they're in a large family, even when they're amongst friends, even when they're amongst other people. And it's important to acknowledge and really tackle loneliness. Similarly, social isolation, which again does lead to essentially lead to loneliness, also is the absence of people around you. And certainly for the more vulnerable people in our communities, like the elderly, like the frail, they can sometimes spend weeks without seeing a person, or perhaps the delivery man who delivers their shopping may be the only person they speak to in a whole week. And whilst as Muslims we recognise that short periods of social isolation can be healthy for us to shut the noise off from the world and just close off from our worldly things and reflect and make sense of our life. This is in stark contrast to someone who sadly lives alone and has no visitors and no communication really with the outside world for weeks on end. And prolonged social isolation and loneliness can have serious detrimental effects on one's mental well-being. As humans, we really are social creatures, and the need to interact with other human beings is an essential and integral requirement for us to feel happy and well. And we often rely on our natural support networks like our families or our work colleagues and friends and neighbours to provide us with this healthy human interaction. And often we provide that to other people without even thinking about it. However, in the current day and age, the breakdown of the family unit, sadly, and the way communities are structured, at least certainly in the physical sense, has meant that many of us have had very little or no social interaction when we need it. And certainly the more vulnerable in our communities, the elderly who live alone, people who may have care needs, find themselves more and more isolated, even if they're living in a large metropolis. And often, with widespread availability of entertainment like television and computer games and access to internet, people rely much less on visiting friends and family as a way to relax, which would have previously been the replacement of entertainment. As Muslims, however, we are encouraged, if not obliged, to visit the sick and those who are isolated and vulnerable in our communities. In fact, visiting the sick and vulnerable is one of the most rewarding obligations for a Muslim. This is all the more important in today's urbanized societies. In a hadith of the Holy Prophet sallallahu alaihi wasallam, it is narrated that Allah, the Exalted, the High, will say to whoever visits his brother for the sake of Allah, "O my servant, it was me that you visited, and your reward is incumbent on me, and I will not be pleased with a reward of anything less than heaven for you." Such a vast reward for something that we would consider as being something very simple as visiting someone. But you can reflect on this and see the value, the difference that we can make to simply visiting someone, because we're breaking down the barrier of social isolation and loneliness for this person that could spiral and lead them into this detrimental and darker place. So other causes of, or rather common causes of mental health issues are things like stress. And this is a very common phenomenon in today's world, certainly in today's urbanized cities and parts of the world. Stress is linked to lots of mental health issues and can come in different forms. And in some circumstances or environments, it can be very difficult to avoid stress, and this can be outside of the control of the individual. So take, for example, an extremely stressful environment like a war zone, prison environments, an abusive relationship, or a situation where where someone has lost a loved one. This can obviously be stress outside of a person's control. And as much as these events cause stress and grief, as Muslims, we encourage to remember that everything is from Allah and to Him is our return, which is a phrase that often is said in such circumstances. Inna lillahi wa inna ilayhi raji'un, meaning from Allah we come and to Allah is our return. And these words are often recited when a Muslim is afflicted with a calamity, and can be a source of comfort because it provides a context to the fact that the worries and the circumstances that the person finds themselves in are actually in the control of our Creator, not in the control of the individual, which immediately absolves it, to an extent, the person of a lot of the stress. But everyday, day-to-day stress that is more common is not necessarily where the external stress is the issue, but rather our response to the environment. So let me give you an example. Two people go for a driving test. Both of them have prepared the same amount for the driving test, and one person may be slightly nervous but otherwise quite relaxed during their driving test. The second person who is prepared just the same may be suffering with severe and crippling anxiety and worry during the same driving test. Although the event is the same, the test is exactly the same. It could be the same examiner on the same day. The experience of the two individuals is completely in contrast to one another. And that tells us that the stress response individually, the personal and unique response that the individual has to the external stressor or the environment, is what contributes to the overall experience of the situation. And we know that repeated and persistently high levels of stress can be detrimental to our mental well-being. That's not to say that we should never engage in anything that causes us stress, because we'd never grow and develop if we didn't venture outside of our comfort zones. But if it's severe and enduring, this kind of stress can also cause mental health problems. This kind of stress is commonly seen in work environments where people are working hard for a promotion, or people have financial worries, or worries about their mortgage, and issues with their spouses and partners, in marital issues and other social pressures of everyday life. But when we are faced with these scenarios of a driving test, or issues in our personal lives, remembering that all outcomes are determined by Allah Almighty can be a really helpful mindset to have, and it can help to minimize some of the stress that comes from these situations. We know that Allah states in the Quran that no misfortune ever befalls except by the permission of Allah Almighty, and whoever has faith in Allah Almighty, He will guide his heart, and Allah is knowing of all things. So take the example of the driving test earlier. As Muslims, we believe that everything is destined by Allah. So if you are destined to pass, then it shall be. And if you fail despite doing all the preparation that you were expected to do, there may be some good reason for you to fail, or rather some benefit in you failing. It may perhaps make you a better driver if you prepare for a second test, or perhaps you may have avoided a calamity on the road that you would have otherwise been afflicted by had you passed the driving test at that time. Now, at the time, it may be very difficult to accept those outcomes, because we're often caught up in the moment. But if we take a step back and reflect, and think that perhaps there was something better for you in that outcome, and knowing that it was destined by Allah, can help us to contextualize our stress and be grateful, I guess, for our situation, even when we think that this might be a less favorable outcome. Other aspects of today's lifestyle, if you like, that can contribute to mental health issues are around materialism and consumerism, and really lead on from what we were talking about earlier around the lack of gratitude. So part of life's unhappiness can be created by expectation that we place on ourselves, on our excuse me, on ourselves and on our life. And the expectation of a near perfect life creates this discord between the reality that faces us and the perceived or the imagined situation that we would have expected. And the disappointment of this perceived calamity can sometimes feel overwhelming. And as Muslims, it's very important that we remember that our sustenance is preordained by Allah Almighty, and He is responsible for our provision. And having this state of mind can just ease the pressure that we feel when we're trying to work harder and we're worried about our mortgage and our income and our financial situation. Um, because truly, Allah is the one who is providing for us. Excuse me. And Allah is the one who's providing for us, and we should, and that knowledge should help to alleviate a lot of the worry around income and finances and money. I mean, this does not mean that we don't go to work anymore because we resign ourselves to the fact that Allah will provide. Not that Allah can't provide for you even if you didn't work, but rather our working is an expression of our gratitude to Allah Almighty for the rizq that He's provided for us. Often, we often compare ourselves to people who are doing far better, and certainly social media has a big part to play in this, because often people share pictures when they're extremely happy or joyous, of joyous occasions like weddings and parties and promotions, and often people viewing this can sometimes feel somewhat hard done by, if you like, when they reflect on their own life. And this is partly because they're comparing themselves to the highlights of other people's lives. And this can lead to a person feeling low and feeling resentful to an extent. And as Muslims, we're taught to compare ourselves to people who are less fortunate than ourselves in order to be grateful for our blessings when it comes to worldly matters. In fact, the Holy Prophet ﷺ has advised us to look at those who have less than you, and do not look at those who have more, lest you should belittle the blessing of Allah Almighty that you already possess. So take the example that if you're happy and if you're unhappy and stressed that your car isn't as beautiful and stylish as your neighbour's, for example, or maybe try comparing yourself to someone who doesn't own a car and cycles to work for 15 miles every morning in the rain and snow. That mindset is a completely different mindset to the first mindset, where you're actually worried about your car not being as stylish or as new or as attractive as someone else's car. And social media can sometimes exacerbate this, and certainly for young people who are quite Bismillah. I mean, social media is a whole area of its own when it comes to mental illness and mental health. I mean, with the advent of applications like Facebook and Snapchat, Instagram, Twitter, it means we can keep in touch with people all around the world and communicate effortlessly with people. Instant likes by hundreds of virtual friends can give us a boost in confidence and self-esteem, and the use of social media really has mushroomed in recent years. But certainly some of the effects of social media are similar to the biological effects of addiction, and young people who use social media a lot often crave the pleasure of engaging more and more in this platform, because of the positive feedback from the various likes and so on from the applications. But if you also look at the reverse is also true with such applications and tools. So social media can also quite easily be the source of harm to our self-confidence and our self-worth, as it exposes our flaws in our lives, and often in many cases people expose the private aspects of their life to hundreds of thousands and sometimes millions of viewers who are ready to comment on every aspect of a person's life. Hence, for young people who invest lots of their time in the internet, and on such social media applications, they can often find themselves extremely disappointed if they don't receive sufficient numbers of excuse me. So young people can feel quite disappointed if they don't receive sufficient numbers of likes or perhaps some critical comments by strangers who they perhaps never met. But worse yet, this type of situation can lead to situations of cyberbullying, where groups of online users bully others, leading to devastating consequences, and in some cases, depression in the individuals that have been bullied. Some cases worse, like self-harm, and sadly even suicide. I mean, as Muslims, we believe that true contentment and peace isn't found in such online platforms, but rather in the remembrance of our Creator, Allah Almighty. And Allah Almighty reminds us of this in the Quran. Allah states, "Verily, in the remembrance of Allah verily in the remembrance of Allah Almighty do hearts find peace and contentment." But social media certainly is a potential contributor to mental health issues, and certainly anxiety and low mood can be linked to the effects of excessive use of social media. Other things that can affect your mental health and mental well-being are things perhaps outside of the control of an individual, but things like poverty and certainly wealth inequality is a significant factor. Sadly, we live in an unequal world. Many people in the developed world, sadly, are living in conditions really detrimental to their well-being, and this is in developed nations across the world. And with poverty comes a whole host of physical and social problems, and mental health is no different. In fact, children and adults living in households in the lowest 20% bracket in the UK, which is a developed country, are 2 to 3 times more likely to develop mental health problems than those in the highest earning households. We know that health inequality can't be separated from economic inequality. And as Muslims, we expected to give 2.5% of our savings in zakat to those who are below the poverty line. But this is a bare minimum expectation of those above the poverty line, and those who have wealth are encouraged to give more than this to help tackle this very problem. Other issues like intoxicants and substance misuse, alcohol, recreational drugs that people take for fun, for parties, cannabis, cocaine, heroin. These are simple examples of some of the substances that are available. I'm sure there's a whole host of newer, more complex drugs that are available, and these have a significant effect on the brain, because they alter the biochemistry of the brain and can have very long-lasting effects on a person's long-term mental health and mental well-being, and they're extremely dangerous substances to engage in. And finally, loss of purpose and loss of spirituality in life is also a factor. And in fact, I'd like to finish on this final factor, because in my personal opinion, this is one of the most significant causes of a deep-seated discontentment in the modern world. The world has become a very convenient place. Technology and internet mean we can instantly satisfy our needs through a click of a button. Food can be delivered to our doorstep and ready to eat without the need to cook, let alone hunt. Mass farming and production has allowed for plenty of cheap and affordable food to be available, and entertainment like Netflix and Amazon and Sky provide entertainment for every mood and every taste in our own homes. Higher education is pursued only where it leads to an occupation or an opportunity to gain more wealth rather than the pursuit of the subject matter for self-development and learning. And the idea of getting off the sofa and really striving for something other than the pursuit of more wealth seems illogical. But what then? What happens when all these needs are satisfied? When we're no longer hungry or thirsty? When we've exhausted all the entertainment that we are to our heart's content? Um, we can have things. We've eaten all the different delicacies. At some point in this pursuit of a career, home, our material ambition to seek financial security for ourselves. So along this journey of seeking this, following this material ourselves and our loved ones, we stumble across the question of why. What is all of this for? Is there a purpose, or is our purpose just to carry on for a number of years, consuming and chasing and working until our bodies become sick and decay and in need of help and support? And it is sadly for many towards the end of their life that this realization really hits home and burns a deep hole in everything that was pursued prior. As Muslims, we know that we have a purpose in life, and a purpose and a goal is very, very important for a good and sound mental well-being. On this earth, as Muslims, we know, we believe we have a very short period in this life, and our real life awaits us in the next, in the hereafter. And this life is merely a short episode, and we must live this life with purpose. And the absence of purpose can leave a deep vacuum in our psychological, or if we like, our spiritual self, and leave us feeling this deep-seated emptiness. So in conclusion, really, we've looked at some of the common causes of mental health issues, and over this weekend, some of the other lectures that people will be delivering will be looking at solutions and exploring some of these problems in more detail. But contrary to the age that we live in, there is no quick fix to mental health issues. There's no quick tablet or quick solution over the counter or online. There's no click of a button. Over the course of these 2 days, however, Hijaz community will be offering you some solutions to find a balance in our spiritual and our mental well-being, and hopefully the tools to recalibrate ourselves to our original purpose in life. This is not to say that none of us will ever be afflicted by any upset or grief, or sadly even mental health issues or illness, but we pray that Allah Almighty gives us resilience and patience in times of hardship, and a speedy recovery to good health for those of us who do sadly, who are afflicted by any mental health problems. وآخر دعوانا أن الحمد لله رب العالمين. السلام عليكم ورحمة الله وبركاته.
Alhamdulillah, that was Dr. Abid Iqbal Sahib talking about the causes of mental health issues globally. And from what I can sort of take from that is that we sometimes just need somebody to talk to about some of our problems, because loneliness, anxiety, and depression just build in the world that we live in this busy life these busy lives that we have. And sometimes it's just a brother or a sister that we can lend an ear to, that we should just try to relate to and see if we can, inshallah, reduce those issues that can cause mental health problems.